Did you know that globally, 19 million people die from heart disease every year? That means 3 people die every second, just like that. The shocking truth? 50% never even recognize the symptoms until it's too late. Don't let that be you. Watch till the end to learn how to protect yourself. So in this video, I will share with you 10 warning signs of a heart attack that you should never ignore. This may save your life or the life of a loved one. But first, let's clear up a really common misconception. Is a heart attack the same thing as cardiac arrest? Well, the answer is no. Cardiac arrest is when your heart goes into an unusual electrical rhythm or stops beating, and you may need CPR or a shock to get it going, like you see in the movies. Lots of things can cause this to happen. You could have internal bleeding, heart valve problems, or an enlarged heart, also called cardiomyopathy. You may not have enough oxygen in your blood, and sometimes, it can happen due to electrocution or drowning. So what is a heart attack then? A heart attack, or myocardial infarction, happens when the muscles of your heart don't receive enough blood. This means they start to die, and the longer it goes untreated, the greater the damage. The main cause of heart attacks? Coronary artery disease, a disease of the arteries in the heart. A heart attack needs to be treated immediately. You might be given medications or need a surgical procedure to restore blood supply. And the sooner this is done, the better, because in reality, time is muscle. The more time wasted, the more heart muscle dies. And remember, it won't always be like in the movies, where someone clutches their chest, gasps for air, and collapses dramatically. Now that we know what a heart attack actually means, let's dive into the first symptom to look out for. Symptom number 1, jaw pain. Most people think of chest pain as the main symptom of a heart attack, but jaw pain can be an early and silent warning sign, one that many ignore until it's too late. Why does jaw pain happen during a heart attack? When your heart is in distress, pain signals can be sent to other areas of the body. This is called referred pain, where your brain misinterprets the pain as coming from a different location. One of the most commonly misinterpreted areas? The jaw. Key signs that jaw pain could be a heart attack warning. Sudden, unexplained pain in the jaw, especially the lower jaw. Pain that spreads from the chest, shoulder, or arm to the jaw. Jaw pain accompanied by other symptoms like sweating, nausea, or shortness of breath. Pain that worsens with exertion but eases with rest. Who is most at risk? Women experience jaw pain more often as a heart attack symptom than men. Diabetics may not feel typical chest pain and instead experience jaw discomfort. People with high blood pressure, obesity, or a history of smoking should be extra cautious. What should you do? Don't ignore it. If you experience jaw pain along with other heart attack symptoms, call emergency services immediately. Time is everything when it comes to saving your heart. Symptom number 2, chest pain. I told you that not everyone who has a heart attack experiences chest pain, but chest pain or discomfort is one of the most common symptoms. It could feel like pressure, squeezing, or heaviness in the chest. Indigestion or acid reflux, some say it feels like the worst indigestion ever. Like there's an elephant sitting on your chest. Women are more likely to have other symptoms like shortness of breath, nausea, vomiting, back pain, jaw pain. Sign number 3, sleep disturbance. Many people don't realize that sleep disturbances, such as difficulty falling asleep, waking up frequently, or feeling unrest, can be an early warning sign of a heart attack. While chest pain and shortness of breath are well-known symptoms, poor sleep in the days or weeks leading up to a heart attack can indicate that the heart is struggling before an emergency occurs. How sleep disturbance is linked to heart attacks. 1. Oxygen and blood flow issues. The heart pumps blood to deliver oxygen to the body, including the brain. When the heart is under stress, due to blocked arteries or early heart disease, oxygen supply becomes inconsistent, leading to restless sleep, frequent awakenings, or gasping for air at night. 2. Nervous system activation, fight or flight mode. Before a heart attack, the body releases stress hormones like adrenaline, which increase heart rate and blood pressure. This hyperactive state can cause insomnia, night sweats, and unexplained anxiety at bedtime. 3. Sleep apnea and heart disease connection. Obstructive sleep apnea, OSA, a condition where breathing repeatedly stops and starts during sleep, is a known risk factor for heart attacks. Sleep apnea reduces oxygen levels, forcing the heart to work harder, which can trigger a heart attack in vulnerable individuals. Warning signs in sleep that may indicate a heart problem. Frequent waking up at night for no reason. Sudden shortness of breath or gasping while sleeping. Restless sleep despite feeling exhausted. Unusual night sweats without high room temperature. Racing heart or palpitations at bedtime. Persistent nightmares about death or suffocation. Why this matters? Studies have found that people who experience sleep disturbances before a heart attack often don't realize their heart is at risk. Instead of brushing off poor sleep as stress or lifestyle habits, it's crucial to recognize it as a possible early sign of heart trouble. If you or someone you know is experiencing sleep problems along with fatigue, chest discomfort, or shortness of breath, seek medical advice immediately. It could be a silent warning of a heart attack waiting to happen. Symptom number 4, cold sweats or diaphoresis. Cold sweats. You might think it's just stress or overheating. But what if I told you? It could be your body's silent alarm for a heart attack. Most people associate heart attacks with chest pain. But did you know that sudden, unexplained cold sweats could be one of the first signs? When your heart is in distress, your nervous system kicks into overdrive, triggering excessive sweating, cold, clammy, and out of nowhere. If you suddenly break out in a cold sweat along with dizziness, nausea, or chest discomfort, don't ignore it. Many heart attack patients say they felt cold sweats before the pain even started. It's your body telling you something is very wrong. Symptom number 5, nausea or vomiting. Why does a heart attack cause nausea and vomiting? 1. Reduced blood flow to the stomach. During a heart attack, the heart struggles to pump blood efficiently. This can disrupt digestion, leading to nausea, vomiting, or stomach discomfort. 2. Vagus nerve stimulation. The vagus nerve, which connects the brain, heart, and digestive system, can become irritated when the heart is under stress, triggering nausea and vomiting. 3. Toxic buildup due to oxygen deprivation. A heart attack reduces oxygen supply to major organs, causing the body to release stress hormones that make a person feel weak, dizzy, or nauseous. How to tell if it's a heart attack, not just an upset stomach. Nausea with unexplained sweating or dizziness. Vomiting along with chest discomfort or tightness. Indigestion-like pain that spreads to the arms, jaw, or back. Feeling lightheaded or suddenly weak. Symptoms persist despite taking antacids or resting. Symptom number 6, shortness of breath. Shortness of breath, dyspnea, can be one of the earliest and most overlooked signs of a heart attack. Some people experience it before chest pain, while others have it as the only symptom, especially women and older adults. Why does a heart attack cause shortness of breath? 1. Heart struggling to pump blood. When a heart attack occurs, blocked arteries reduce blood flow, making it harder for oxygen to reach the lungs. This makes breathing difficult, shallow, or labored. 2. Fluid buildup in the lungs. A weakened heart can cause fluid accumulation in the lungs, pulmonary congestion, leading to a tight, suffocating feeling. 3. Increased stress on the nervous system. A heart attack triggers the fight or flight response, which makes breathing rapid and irregular, even at rest. Signs that shortness of breath may be a heart attack. Sudden breathlessness without exertion. Feeling like you can't get enough air. Shortness of breath along with chest pain, nausea, or sweating. Waking up gasping for air, especially at night. Breathing difficulty that worsens when lying down. Symptom number 7, heart palpitations. Heart palpitations, a rapid, irregular, or pounding heartbeat, can be an early warning sign of a heart attack, especially when combined with other symptoms like dizziness, chest discomfort, or shortness of breath. While palpitations are often caused by stress, caffeine, or dehydration, they can also indicate a serious heart problem, including an impending heart attack. Why do heart palpitations occur during a heart attack? 1. Reduced blood flow to the heart. When an artery supplying the heart becomes blocked, the heart struggles to maintain its rhythm, leading to irregular or skipped beats. 2. Oxygen deprivation. A heart attack can disrupt the heart's electrical system due to lack of oxygen, causing episodes of rapid heartbeats or atrial fibrillation, AFib, a condition linked to heart failure and stroke. 3. Overactive nervous system response. The body's fight-or-flight system kicks in due to heart distress, flooding the body with adrenaline and causing the heart to race unexpectedly. Warning signs that palpitations could mean a heart attack. Fast, irregular, or skipping heartbeats with no clear trigger. Palpitations combined with dizziness, sweating, or nausea. Fluttering sensation in the chest along with chest pain or pressure. A sense of panic or impending doom. Feeling lightheaded or about to faint. Symptom number 8, dizziness or lightheadedness. Feeling dizzy, lightheaded, or like you might faint can be a warning sign of a heart attack, especially if it happens suddenly and without explanation. Many people dismiss it as dehydration or standing up too fast, but it could mean the heart is in distress. Why does a heart attack cause dizziness or lightheadedness? 1. Drop in blood pressure. A heart attack weakens the heart's ability to pump blood properly, leading to low blood pressure and reduced blood flow to the brain. This can cause a floating sensation, dizziness, or even fainting. 2. Lack of oxygen to the brain. Blocked arteries prevent oxygen-rich blood from reaching vital organs, including the brain, causing sudden disorientation, blurred vision, or confusion. 3. Irregular heartbeat, arrhythmia. A heart attack can disrupt the heart's rhythm, leading to palpitations, rapid heartbeat, and an unstable blood flow, which makes a person feel weak or unsteady. Signs that dizziness could be a heart attack warning. Feeling faint or about to pass out with no clear reason. Sudden dizziness along with chest discomfort or nausea. Lightheadedness that worsens with movement. Unexplained weakness or lack of coordination. Cold sweats and confusion. Symptom number 9, tingling or discomfort in other body parts. Heart attack symptoms don't always happen in the chest. You might feel tingling or numbness in the arms, especially the left arm or both arms. Pain in the jaw, back, or stomach. If it's not going away, pay attention, it could be a heart attack warning sign. Symptom number 10, anxiety. An overwhelming feeling of anxiety or impending doom, similar to a panic attack, could be a sign of a heart attack. If you're unsure, get checked immediately. A doctor can do tests like troponin blood test, checks for heart muscle damage. ECG, checks electrical activity in your heart. These tests will help confirm if it's a heart attack or just anxiety. How to prevent a heart attack? Know your risk factors. Visit your doctor to check for high blood pressure, diabetes, and cholesterol. Eat a heart-healthy diet. Exercise regularly. Stay hydrated. Quit smoking. Diabetics and women often experience different symptoms, like fatigue, back pain, or nausea instead of chest pain. If you have diabetes, your heart attack could even be silent. According to the National Institute of Health, controlling blood sugar can help prevent heart disease. High blood sugar damages blood vessels, increasing your risk of heart attacks and strokes. Be sure to watch my YouTube video on diabetes right after this. If you experience any of these warning signs, call emergency services immediately. Do not drive yourself or let someone else drive you, call an ambulance instead. If you have diabetes, click the link in my description to download my ebook on how to reverse diabetes naturally in just 2 simple steps. That's it, 10 warning signs of a heart attack you should never ignore. Thank you for watching.